Mike?
Sue, you saw it happen on Christmas Eve. Healthcare reform bill got through the Senate, and with us right now, Congressman Joe Sestak and Congressman Jim Gerlach. Thank you for coming in.
Good to be here.
Okay, so we still have to go through conference committees now. Explain that to our viewers. This is not a done deal all the way as far as healthcare reform.
We're going to have a conference. The Senate will have representatives, and the House will have representatives, and then it will be an up or down vote in each chamber. My objective is to bring the good parts of the House bill into it, because I think the Senate bill was an adequate step to get us to conference. But there's things in it that have to be changed.
And we will get into that in just a second. What are the things you want to see stay, and what do you want to see go?
Well, everybody agrees that we need to undertake some very significant health care reform. The question is, what will that reform be? Everybody agrees that we need to allow folks with pre-existing conditions to be insured, allow you to take your insurance policy from one job to another, called portability.
That's going to stay.
Well, those things will stay, and those things have wide bipartisan support.
Okay.
It's where you start getting into taxes and reducing monies for various programs that will hurt seniors, for example. That's when you have a lot of disagreement.
What do you think will hurt seniors?
Well, the Medicare Advantage program will be reduced in funds in the coming 10 years. That'll reduce the access to seniors to that Medicare coverage that they rely on every single day. That's going to hurt a lot of seniors. That's one example.
You don't want us to be able to opt into that at 55?
No, I think that would be a hugely expensive proposition and not necessarily get us the quality care that we need.
What do you want to see? What do you want to have stay, and what do you want to go?
What I want is the House bill to prevail. And if we're successful, here's what you're going to see. Seniors will no longer have that donut hole where they have to begin paying several $1,000s of their own for care. They won't have to pay any co-pays for pre-existing conditions. Imagine children will now no longer have to worry about oral, dental, or hearing. And get this. Of all the uninsured in the 5 counties of Philadelphia, 66% are working people with families that don't have health care. We're all going to be covered. And now women, they won't have to pay twice as much as they did before. Everyone will be covered. And the Congressional Budget Office says our House bill will reduce premiums 25% in 6 years. That's why it's affordable.
Yeah, Congressional Budget Office also says our deficit will be helped by like $132 billion over the next 10. And they take the next 10 after that up to 20 years from now. We may be in the trillions in savings as far as the deficit.
Well, both the House bill and the Senate bill talk about reducing expenditures in Medicare and other areas. I don't think Congress is going to have the discipline in the next decade to actually allow those cuts to happen. I actually think we're going to see an explosion in the deficit as a result of either one of those bills being passed at a time when we've already seen now the national debt grow to $12 trillion. We simply can't afford that kind of legislation being passed.
But that's no reason, just because Congress, senators particularly, can't control themselves and get liquored up. No, vote them out. This is a good bill, and we should not pass it because we think politicians can't be held accountable.
Is it too watered down, though? The president promised change, and without the public option, it doesn't seem like he got what he wanted.
We need the public option, and that's what we're going to fight to get in.
You're not going to get that, are you?
Well, we need something called a cat or mouse. Here's what has to be changed, called by whatever name, right here in this Philadelphia region. In this media market where Fox covers, 42% of Pennsylvanians live. And do you know, one company owns 70% of all health care plans. It's a monopoly. So we want a fair competition out there in order to break that monopoly, because we don't want Pennsylvanians to have in the next 8 years what happened in the last 8 years, that our premiums doubled in price.
So you don't think that there can be that competition without a public option?
There are other means by which you could try it, but the public option is the best one, and that's why I'm going to be in there every day slugging it out for that public option.
Public option, what do you think of that?
Well, I think it's dead, really, and I think it should be. I think it's not competition. It's going to take over the entire playing field and crowd out the private sector and ultimately lead to government-run health care, which I just don't think is the right direction to go.
Now, when do we get through all these conference committees?
We're hoping to do this before the State of the Union, but it might take until the end of January.
Third week of January?
Yeah, 3rd or 4th of January is what I predict. Jim, do you think about that?
I think that's probably about accurate. Yeah.
Okay. Yeah. We'll see what happens. We'll have you back.
We're looking forward to it. Great to be here.
Thank you, guys.
Thanks for having me.
That was excellent. That was a good debate. 8:18 now. It's hard to get rid of those, or it's time.